Hi, my name is Enosh, and what's your name?
Hi, my name is Alea.
All right, cool. We'll be conducting your interview for today. Um, ready to start?
Yeah.
Jump into it. Okay, so can you indicate why and how your interest in being a physician has developed, along with what have you done to demonstrate your commitment to this profession?
Well, ever since I was younger, I always admired a physician. I always admired their passion for their work and their dedication to helping their patients get better. When I was in high school, I joined a 4-week program where we were able to shadow physicians and volunteer in the hospital. We also work alongside first year medical students, and the physicians were from different fields, and so we got to learn the day of a life of a neurologist, a gynecologist, a surgeon, and we also got taught like what we would learn in the first year of medical school. And ever since then, I've just had a passion for it. I've also volunteered in multiple hospitals, both in the U.S. and outside of the U.S., and I've also shadowed there.
Okay, so you mentioned you did some volunteering work while in high school in different countries. What were those countries?
Uh, in the U.S. and also in Jamaica and the Dominican Republic.
Okay. How did it differ from country to country, like your experience there?
In Jamaica, I volunteered at Kingston Public Hospital. I volunteered there for a month, and it was different in the sense of patient care. There were not a lot of resources. The hospital was located in an area where mainly people of like lower income would come there, and so the treatment was different in terms of, as I said, there were a lack of resources, and so the physicians had to find different ways to treat these patients. They weren't always able to do run multiple tests to find out what was wrong, and so they had to just use based upon their symptoms and like previous lab work to decide what was wrong with the patients. Compared to when I volunteer here, there are more resources, and so more tests can be run, and so on.
Okay. So it sounds like you've had a bit of experience in the medical field here
Yeah.
and there. Awesome, awesome. Okay. Can you indicate how and why you chose your major? Also, how has this choice benefited you personally and professionally?
Well, coming into the University of South Florida, I knew that I wanted to go to medical school, and so my choice of major was based upon that. Biomedical science seemed like it had me on the right track to get to medical school and complete all my prerequisites, as well as it opened the lane for me to do research. There were multiple upper level classes in not only biology but also in chemistry, and so when I volunteered at the research lab, it gave me knowledge on like what I needed to know, as like the lab that I work in was the lab of public health.
Okay, so how long have you participated in your research?
I volunteered at the College of Public Health for over a year now, and we've worked on multiple projects. Our most recent project is getting cell cultures from the rectum of patients with rectal cancer, and basically performing different test on it to see if they would be responsive to chemotherapy or not. This will help like patients in the long run, from spending like extra time and energy going through chemotherapy if they know that they're not going to be responsive to that type of treatment.
Okay, cool. Um, can you describe your ideal life in 10 years? What you'll be doing? What will your personal life be like? And what will you still be working on?
In 10 years, I would hope to be completing my general surgery residency, hoping to get into plastic surgery, as that's what I want to do in the long run. I also would like, kids and a family. But one thing I'm very interested in is going back to Jamaica and starting a mentorship program and working with kids in both high school and in middle school, and basically showing them that I was once in their position, but I was able to, for example, go abroad and study and get into medical school and be where I am today. I would also like for hopefully my fellow colleagues to work with me on that, and so sort of build a program where each student can get a mentor if they're like interested in going into the medical field, and so that they know if they keep on the same track that they can be where we are someday.
Okay. Can you describe a time when something negative happened to you, um, or you went through something difficult, but which in hindsight can be viewed positively? And can you explain?
Yes. On January 1st of 2017, I was diagnosed with type 1 diabetes, and that was a big struggle for both me and my family. It was a struggle to find, like, to see how I would manage it. It was like something different, and I was also in college at that time. It was like my first year in college, so it was a big difference in my life. I had to structure how I eat, taking insulin, remember to testing my blood sugar, stuff like that. But I feel through that I've like met a lot of people. I've like built a lot of connections, and it's just driven me into wanting to do research in type 1 diabetes to help children like me, hopefully one day.
Okay. How would you describe your leadership style? Describe an example when you had to adjust your leadership style to address the needs of a group.
I would say that my leadership style is more democratic. I tend to take the consideration of others in before pushing the final decision, asking others their opinion on a certain matter. But recently, last year, I was the treasurer of Jamaican Alliance Movement here at USF. And at that time, both the vice presidents and the presidents were not able to be as active as they could be. They were doing internships, and it was their final year. And we had a banquet coming up in 4 weeks, and so I had to take the initiative and be more authoritative, telling people what they had to do, their different tasks, and that the time that it needed to be done so that the banquet could be what it was.
Okay. Um, so do you think your preferred leadership style is the best way to lead?
No, not necessarily. I feel like it just depends on the situation and also the people who are involved in that situation.
Okay. Uh, what you think is a more important quality for a good health professional? To be an independent thinker or to be a team player?
I would say to be a team player. When you sign up to be a physician, you sign up to a career where you're always learning, you're always doing research. There are new treatments that come out every day. There's also new diseases that we find out about and how to treat them. And so you are never going to know everything. And so there can be another person in the room who knows more than you, not only because they probably did research, but because of experience. And so we should be able to lean on the other persons and make it a collaborative effort, because at the end of the day you do have a patient's life in your hands.
Okay. So, what would you consider to be an important health care problem facing the United States today, and why?
I believe the cost of medication is a big problem right now that we have. Having type 1 diabetes for the past 3 years, I've had to, every month or every 3 months, I've had to buy insulin, I've had to buy pens, I've had to buy test strips, and this is very costly. I do have insurance, and so the price of insulin for a month would be like $35, or if I'm buying it for 3 months, it would be $120. But if you're someone who doesn't have insurance, it can be up to $1,000 for a 3 month worth of insulin. And so I've also seen this in Jamaica, where I volunteered as well, where a lot of patients did not have insurance, and so what they would do is that with the money that they have, they would buy enough insulin as they could have. And so what they end up doing is rationing that insulin for their meals. And so this will lead to complications when they do come in with for example, like kidney problems or liver problems. Their consecutive high blood sugars and high A1Cs would affect and cause more complications on top of the disease that they're coming in with. And so I feel like that's a problem that we need to fix it here in our country, because especially during the corona outbreak, there has been times where now they're lowering the cost of insulin, for example, and it's like, why could not that have been done throughout the time?
Okay. Um, so aside from the medical field, what other organizations or volunteer activities have you been a part of?
Here at USF, I've been a part of Bull Service Break twice. Bull Service Break is a 1 week program, community service program during spring break where you go and you tackle an initiative. I've been a part of the LGBTQIA initiative as well as the human trafficking initiative. And so, for example, for the human trafficking one, during 2019, we went down to Miami and we worked with an agency down there. And human trafficking is actually in Florida is really big, and so we worked with not only the organization but police there, and we also went to different organizations and like taught them like what some red flags are for human trafficking. We told them that there's a class available. We also operated a human trafficking hotline where people could call in and tell us if they had any tips. We also worked with some victims and psychologists and stuff. Another thing that I'm a